I believe that the spread of the coronavirus didn't necessarily teach us new or profound lessons about health inequity. Rather, it renewed public focus on the necessity for systemic changes in our healthcare system.
What COVID-19 has really reinforced is that age, racial, ethnic, all sorts of underlying health status, we have to really address the needs of those vulnerable populations because they're the ones at most risk for this type of disease.
Sadly, I feel like the people who are going to care the most about minority patients and those who are underserved are people who look like them. If our goal is to increase the number of physicians that are available who look like these patients, we have to have the proper infrastructure and support available to students who are becoming physicians.
Health inequities are always an important issue to address for me. Even prior to this pandemic, it's just so important to understand how a person's background impacts their health outcomes. That's the most important thing that I think that we take from this, asking those questions. What are the barriers that people are having when it comes to them reaching their health goals?
Data on case numbers, testing, and vaccine accessibility information should really be provided to all community members in a culturally sensitive way that can be easily understood regardless of language and literacy level. And I think that by making these changes, we can really increase access for those who are part of underserved communities in our country. And it will really go a long way in addressing the health inequities that lead to some individuals being disproportionately affected by COVID-19.
Something that we always have to be aware of is treating people the same, regardless of their gender, their race, and in this case, their systemic health issues that they may have.
I think the pandemic exposed the worst in our health inequities, the need that we have to address all those disparities, whether it's disparities in education, disparities in housing, disparities in technology access, disparities in healthcare access, all these conditions, all these challenges that our society faces. There's not one thing we're going to fix that will do this, but it comes from a place of equity for all the social determinants of health.